Hello everyone, my name is Gabriela Olivas and I will be presenting a wild child assessment today for my case study. So this is a 6-month-old male with no acute concerns. His history of present illness includes patient is breastfeeding on demand, mother is feeding pureed table foods, and she has not noted any allergic reactions. Infant is voiding about 8 diapers per day and stooling between 1 to 2 times per day. Per mother, infant is sleeping in his crib. He's taking about 3 naps per day and sleeping throughout the night. And he currently remains in a rear-facing car seat while in any vehicle. My review of systems: his weight. Mother states his infant has been gaining weight. Skin. There are no rashes, lumps, bruising, or bleeding. HEENT, no unusual head shape. Hearing test at birth passed per mother. She denies noticing any draining ears or ear tugging. She did say that he turns when his name is called, and he turns towards familiar voices. Cardiac. Mother denies any cyanotic events or history of murmurs. Respiratory. Mother denies any recent respiratory illnesses, any cough, or contact with people with TB. GI. Mother states infant is breastfed on demand every 4 hours. She does not have any issues with feeding her baby, and baby is tolerating introduction of new foods. She denies any diarrhea, constipation, and as of now, infant does not have any teeth, but she has taken him to the dentist, and she's to follow up in 6 months. GU, infant is voiding well, and he's voiding about 8 diapers per day. Musculoskeletal, she has no concerns, no injuries reported. Baby moves all limbs equally and spontaneously. Allergies, he has no known allergies. His immunizations are up to date, and he is due for his 4-month vaccines today. He's not on any medications. Prior medical history, he has no prior hospitalizations or surgeries. Family history, this is an African American family. Mother denies any cardiac disease, hypertension, stroke, cancer, and early death in family members. Social history, infant lives with mother and father in a home with 3 bedrooms, 2 baths, and no siblings. Growth and development, infant recognizes parents and smiles and is cooing, turns to voices, is rolling from stomach to back and back to stomach. He's sitting upright since he was 5 months old. His vital signs today were temperature was 97.7, heart rate 125, respirations were 45. His weight is 9.5 kilos, which is greater than the 95th percentile. His height or length was 73.5, and that's also greater than the 95th percentile. His head circumference was 46, also greater than the 95th percentile. For his physical exam, general, baby was alert and active. He was pink and well perfused, well groomed and dressed. For skin, he had no rashes or skin abnormalities. His head was normal, atraumatic. His anterior fontanelle was 2 by 2 centimeters. His eyes were had positive red reflexes and were equal movements, and his eyes were pearla. Tympanic membranes were clear and pearly gray. No pain or discharge noted, and they were normally set. His nose, his septum was midline. His mucosa was nice and pink. He had no discharge and no inflammation. His throat was clear, no erythema, no drainage. His mouth was moist. His palates were intact, and he did have quite a bit of drooling noted, but no teeth. Respirations, he was clear and equal. He had symmetric chest movements, and he was not in any type of distress. For cardio, his rate was normal. His rhythm was normal. His pulses were equal in all 4 extremities. He did not have a murmur, and his capillary refill was less than 2 seconds. abdominal, he had normal bowel sounds. His abdomen was soft, non-distended, non-tender, no hepatosplenomegaly for GU. He had normal external genitalia, testes were descended, and he was circumcised. Spine, his spine was straight, no defects, no sacral dimples. Musculoskeletal, he was moving out his extremities equally, had normal tone. Neuro, he had normal tone and reflexes, rolling from back to stomach and stomach to back. He was able to support himself when prone with his elbows holding him upright. He's babbling and he can sit himself. He can sit upright by himself. So we did not do any labs today. Immunizations he will receive today will be DTaP, IPV, and HIB, pneumococcal 13, and rotavirus. So for the assessment, this was a wild child assessment with ICD-10 code Z00.129 and vaccine administration, which is Z23. So my plan was administration of 6-month vaccines, which includes the pediatrics, which is code CPT code 90698, and he will be receiving 0.5 mLs IM once now. He will also receive the Haemophilus B conjugate vaccine, which is 90647. He will receive 0.5 mLs IM, and then he'll receive his PCV 13, which is 90670, and he'll receive 0.5 mLs IM once now, and he will receive his rotavirus vaccine, which is CPT 90680, and he will receive 1 ml PO now. For my vaccine post-care, we ordered acetaminophen, 10 milligrams per kilo. So he weighed 9.9 kilos, so using the concentration of 160 milligrams for 5 mLs, he will receive 3 mLs PO Q4 to 6 hours for fever or pain. Mom was also advised to apply cold compresses to injection sites to reduce redness, soreness, and swelling. Feeding changes. I asked Mom to add new foods one at a time, offer it with a spoon, and wait 2 to 5 days between introduction of new foods. Mom is not using Gerbers. She is making her own foods. So we did tell her that it was okay, and she is using one of the little feeders that has a little net so that baby won't get any big pieces where he can choke. So anticipatory guidance and patient education that was given. Mom was instructed to continue breastfeeding at lib. She was advised not to give any juice, not to give any honey until after his first birthday. She was advised not to give cow's milk until after his first birthday. I advised her to introduce a cup. She was educated on proper hand washing before and after feeding and diaper changing. We discussed proper car seat safety and placement in the rear-facing car seat. We discussed water safety and informed her never to leave her infant alone in the tub or in near any water buckets, toilet, anything. She was also advised not to carry any hot items while she's holding her baby. We discussed choking prevention and foods and items that baby can choke on. Advised on placing infant on his back to sleep. We also discussed against co-sleeping. We encouraged her to establish bedtime routines. Mom was informed that nighttime feedings were not necessary. No one smokes in the house, but we did re-educate on no smoking around infant. And I also advised her not to leave pets unattended around the infant. So Mom was advised to return to the clinic at 9 months of age for his next well assessment. So I believe guidelines were followed as far as well child assessments. Mom is following up with her vaccine schedules and for her well visits. Um, Baby looks good, although he's big. He's proportioned. He's all above 95th percentile, not just in weight or height. So he looks proportioned and healthy. Um, and I encouraged mom to just continue doing the wonderful job that she was doing. Thank you. This concludes my presentation.